Okay. Now we're going to move on to the femur. This is the upper leg bone, which would be the femoral or thigh region from the hip down to the knee joint. In the femur, this is the longest bone in the body. It is a long bone that we've covered before in long bone anatomy. Now we're going to talk about specific anatomy to this bone. So we'll start on the proximal end. Up here's the head, this round structure here. This articulates with the acetabulum to create the hip joint. On the head, we have a divot here called the fovea capitis, which is marked in blue. Then underneath the head, we have a neck that helps connect the head to the rest of the femur. Then up here on the proximal metaphysis, this wide area, on the lateral portion, we have this big chunk of bone here called the greater trochanter, where a lot of muscles attach to. And then if we go around to the posterior medial side on the proximal end of the femur, we have what's called the lesser trochanter. Then if we go to the lateral posterior proximal end across from the lesser trochanter, we have this structure right here called the gluteal tuberosity. All of these structures, the greater trochanter, the lesser trochanter, and the gluteal tuberosity, their purpose is for the attachment of muscles or skeletal muscles to the bones so they can pull on them and create movement. Next, if we go down the posterior body of the femur, we see marked in green here, we have a ridge on the medial and lateral side that make up a structure called the linea aspera. Then from here, this is all on the anterior and posterior side. This is all the body or diaphysis of the femur here. Then we get to the distal end of the femur. On the anterior side, we can see here we have the remnants of an epiphyseal plate, which is now the epiphyseal line where the growth plate has closed. Right here below that, we have what's called the patellar surface. You can see there's a little concavity. Some folks even refer to this as the patellar fossa. That's where our kneecap sits in and glides. Then if we go out to the medial and lateral portions of this distal femur, we have what's called condyles. We can see them from the inferior and posterior side really well. This structure right here is called the medial condyle. It's on the medial side because it's below the head of the femur. So that's always going to be on the medial side, medial condyle. And then across from it's going to be the lateral condyle. Now, in between the two condyles, the medial and lateral condyle, we have the surface marked in red. This is the intercondylar fossa. That's where we're going to find on the tibia, there's a structure called the intercondylar eminence, where ligaments come off of that structure of the tibia and attach to the inside of these medial and lateral condyles. But when you bend the knee, that eminence will glide in between there and not shear the ligaments. The last structures we'll talk about on the medial and lateral condyles are the medial and lateral epicondyles. This will be attachment points for ligaments through the knee joint. You'll also notice that the medial epicondyle is much more prominent than the lateral epicondyle. And those are the structures of the femur.